¿Comenzamos?
Empecemos, sí.
Muy bien. Muy buenos días.
Good morning.
Bienvenidos todos y todas.
Welcome, everyone.
En nombre de la Unidad de Recursos
In the name of the Human Resource Unit
Servicios de Salud
for the Health Systems Department and Health Services from OPS
de la Organización Mundial
and the Regional Office of the Americas with its headquarters in Washington, D.C. We welcome you to the seminar. We thank you for being here. It's a high-level webinar to transform the education of health professionals 2030, with the objective to address relevant topics in education of health professionals through discussions and exchange of perspectives
expertos internacionales de alto nivel.
and experiences with health professionals expert acknowledged in the field of education and health in the context of the recently approved OPS Policy on Health Personnel 2030. Before starting, we're going to give you some explanations about this webinar. Before welcoming our subdirector, Dr. Silly Thomas, I want to leverage and give you instructions to maximize participation of everyone in this high-level event. This session has simultaneous interpreting, which can be accessed to the 3 languages through the icon in your window. To communicate any technical issue and comments and questions targeted to the speakers during the sessions, please use the Q&A. Lastly, this session will be recorded in English, Spanish, and Portuguese with the intention to share all materials. And also, we're going to publish the session through the YouTube channel of OPS OMS organization. With all this, and with the pleasure that we have to have you here, now it's turn to our subdirector, OPS, Rhonda Silly Thomas. Go ahead, Dr. Silly Thomas.
Good morning, ladies and gentlemen. I welcome everyone today to the Pan American Health Organization, or PAHO's high-level webinar on transforming health professionals' education by 2030, led by our Department of Health Systems and Services, and specifically our Human Resources Unit for Health. I wish to thank all of you in advance for your participation. However, a note of gratitude and appreciation is extended to all participants from the Ministries of Health from throughout the Americas. I also extend a very special thanks to our panelists, Dr. Isabel Cardoso, Secretary, Labor and Education Management for Health, Ministry of Health, Brazil, Dr. Gloriana Mora, Unit Chief for Human Resources for Health, Ministry of Health, Costa Rica, Dr. Leslie Ramsamy, Advisor to the Minister of Health in Guyana, Dr. Wendy Seeley, Lecturer in Nursing, Program Coordinator, Master of Science in Nursing Faculty of Medical Sciences of the University of the West Indies, Dr. Marcos Nunez, President of the Pan American Federation of Associations of Medical Schools, and Dr. Laura Magnia, President and CEO of the Association of Schools and Programs of Public Health. As the Assistant Director of PAHO, I'm very much looking forward to this high-level exchange with national authorities and renowned international experts. It is an important opportunity to initiate an open dialogue on the evolution in the education of our health professionals and the challenges being faced. As a former Chief Medical Officer, I have personally witnessed how patient access to healthcare is being directly impacted by a lack of well-qualified health workers within our health systems. As we all know, the COVID-19 pandemic highlighted both the chronic shortage and poor distribution of human resources for health in the region of the Americas, and the insufficient investment levels in the production, training, and professional development of a fit-for-purpose health workforce in many countries. Our health workforce is in crisis in many countries, and our member states are looking towards PAHO for support. We have heard this message loud and clear. at the recent 60th PAHO Directing Council held in September 2023, where the Policy on the Health Workforce 2030, Strengthening Human Resources for Health to Achieve Resilient Health Systems was approved. Given this, and as we emerge from the pandemic, we are witnessing a seismic shift in the recognition of the importance of health workforce and an urgency to invest in health professionals, especially in their education, so that they can respond to the complex array of healthcare needs and demands in the 21st century. During today's high-level webinar, we will be addressing key issues in the education of health professionals and sharing the experiences and perspectives of national health authorities and high-level international experts in the field of human resources for health and education. PAHO remains committed to strengthening the capacity of health professionals through the Americas, improving access to education throughout the life course, and indeed, through our PAHO Virtual Campus for Public Health. We continue to work with health, labor, and education sectors in the improvement of curricula for health professionals and with professional associations, universities, and collaborating centers in the development of standards and methodologies that will ensure quality of care for all. Interprofessional education is a priority for our organization, as is collaborative practice in primary health care, as well in the delivery of specialized care. The education of our health professionals must be oriented towards supporting the development of highly effective interprofessional teams at all levels of the health system. With that said, I want to once again thank all of you for your participation in this very important meeting. Together, let us continue to take action to develop more resilient, well-qualified health professionals as part of our joint efforts towards transforming health systems based on primary health care. Thank you so much.
Muchísimas gracias, doctora Seeley, por su mensaje de bienvenida. Y ahora, para continuar,
Thank you,
entonces,
Dr. Seeley, for your welcoming message. And now to continue with our seminar, I want to start panel number 1, the first panel of this morning, challenges and opportunities to transform education of health professionals. Now we welcome Dr. Benjamin Portas, Chief of the Human Resource of the Department of Services of OPS-OMS, and our panelists in this first panel. Dr. Portas, go ahead. Thank you and welcome to everyone. In this panel, as Dr. Cunha said, we're going to speak about the challenges and opportunities to transform education of health professionals from the national authorities' perspective. For this reason, we have the opportunity to listen to our panelists who will present their ideas and perspectives during 10 minutes. Later, we'll have a space to answer one question. We won't have much time, regrettably, but it's important that we have the space for Q&A. Here, we want to have the chance to speak about opportunities to transform education from the policy and sanitation from the experiences of the countries. Without further ado, I'm going to start this first panel with the presence of Dr. Isabela Cardoso, Trabalho de Gestão Secretary from the Ministry of Health in Brazil. Go ahead, Dr. Cardoso.
Good morning, each and every one of you. I am very pleased to be here with you in this important webinar where we will discuss the needed transformations in terms of education.
We can project, Dr. Benjamin.
My presentation, please, Benjamin. Thank you.
We've done a small presentation.
We have a small presentation to help us.
So I started in the Secretariat, and I want to start speaking about this important topic for us, which is about building a big national policy of work and education in health, where the transformation and changes are necessary
and policies are needed to move
go
forward in the group of policies that are
we need
to be implemented. First of all, I
also
would like
wanted
to
to
highlight
speak
the
about the
social and
social
economic
transformation,
and
economic
cultural
and cultural
transformations we
transformation
live
that we have in
in
contemporary
our
societies
society today,
that produce
which have
changes
given
in the
us
needs, in the health needs.
many changes
And
and
so
very complex
it depends
changes.
on us
As directors,
and the
as government
governments
workers, we need
to
different
have
processes
practices
in terms of education to
that
help
can satisfy
cater to
the
the needs,
needs of the models
especially in the traditional and hegemonic models
and
which
that are
may yet
being
be in
used.
place.
So the
These new
new health
practices
practices need
require
new
a
models and
model of
investments in management
capacity building
that can
and work
support
management
doing
that
new
gives support
practices.
to these new
So
practices.
in this way,
We
we'll,
can
we'll be
only
able
do
to
this
work
by
together with the educational and
working
health
together,
systems,
the health
and
system
we can
and the
have
education
practices of
system
integration,
as a
especially
whole,
of
in terms of
collaboration between the different systems
collaboration.
and
And that
different
is
areas.
why we
And
have invested
we're
in
working on this in
Brazil
Brazil
in
for health
training our
teams
healthcare teams, specifically in the
so that
issues
they can
and
incorporate in their
what is needed in
curriculum
terms
all the
of
necessary
education and
topics for these
competencies to
practices.
put
And
these
we're doing
practices
big
in place.
efforts
We have worked
to
very
have
hard in
dialogue with the Ministry of
establishing
Health and
closely
between the
knit
Ministry of Health
ties
and
with
other
several
government ministries, for
ministries, for
example,
example, the
the Ministry
Ministry
of
of
Health and the
Education,
Ministry
of
of
Work,
Labor,
of
Education,
uh, Management,
so that to
and a
strengthen
series of
this
strategies
movement.
are
Can you
used
go to the next slide,
nowadays to
please?
strengthen this movement.
So it's about education
In
responsibilities to the
terms
federal
of
level, the unique
management,
system
we
of
are
health, to
responsible
the formulation of
for the
policies
federal
that have to do
management
with
of the
management,
universal
formation, and
health
training
system regarding the
of
formulation of
workers,
policies
and also
that
the
steer the
regulation
management,
at
training,
work in
qualification
the
of
health
workers,
sector.
and the regulation of
You can go
work
to
in
the
the
next
health
slide.
sector in Brazil.
We have then,
So
we're
we
building
are
in the
building
country a country that's large, a
our
country
work
that's
in a
diverse.
country
We
which
have
is very
individualities, we have
large, very
differences,
diverse. We
but
have
we're
several
trying to do
inequities and
a joint
inequalities,
construction
but we're
with all
trying
the
to build
states
this
and
together with
municipalities
the states
to
and
build a policy,
municipalities. We're
national
trying to
policy
pitch
for
together in
work and
building a
education
national policy
with big
for
efforts
management of
to
work and
coordinate different
education,
fields
for health,
to
to make
allow
sure that
the
all of these
access
areas
and
work
the domain of
together,
new technologies to
articulating
workers.
health education as well, ensuring access and mastery of technologies for our workers, investing in planning, monitoring,
Creation of
and
articulation
evaluation of the
and
GTES,
set
what
the
we call this
financial incentive
articulation between
in all
areas,
states to
offering
strengthening
financial
the
incentive, technical support, acting as a regulator for all of these areas, establishing a very tightly knit dialogue with educational institutions, whether institutions related to SUS, vocational education, but higher education as well, splitting this encumbrance with several players, municipal players, federal, state players, strengthening our work in building this group planning. We've been investing in resources and technical teams, especially in a program called Valoriza, GTES, Valoriza, which works with all levels of government in Brazil, in which we try to bring into the fold the concept of intersectionality of race, ethnicity,
well
gender, and
training
class in
processes
all of
so
our
that we can have
educational
topics related to
offers.
intersection
We are also
of
working in
races, ethnics, and
articulation
with the
between the
Brazil
Brazilian
agenda
and
and the international
international
agenda
agendas, trying to
to
find
have
where we
the
stand
same
together in
challenges and
facing
working in a
these
joint way to
issues, and
organize
also
work.
communication and visibility for the process. It's very important to speak about the dimensions for adopting these changes from a micro point of view, as I said, including issues of high importance to affect the changes we wish. This also happens in all of the interpersonal and interprofessional relationships and interactions. At a middle level, we look at the organization level or relationship between educational and health institutions, uh, affecting changes in curriculum designs, programs, and curricular components. And at a federal level, we invest in vocational training, reorientation practices for our curriculum designs, programs designs, Pro Saúde, and Pet Saúde. Pro Saúde, which has given us a host of strategies and resources for these students in health, can also access important cross-cutting issues for implementing these policies. We can, of course, not leave aside our efforts. The Ministry of Health has, in fact, created a new secretariat, which is called Digital Health, to transform. Digital health means investing in education, investing in digital changes, which of course must keep on par with social development. Of course, we need to use technologies to implement public policies and restructure the health system to make sure it works, whether in primary health care, health surveillance, specialized care, indigenous populations health, work management, and education. We mean to expand digital inclusion, giving access to technology and critical technological training, which is very important for our healthcare workers to improve work processes and satisfy the needs of the unified health system. When we invest in their education and their capacity building, these needs are met. We must understand that the technological transition process is crucial to meet the infrastructure needs of our health system, including connections in our continental country, Brazil, a huge country, making sure that healthcare professionals have internet access, digital literacy, preparing the teams for new work processes, and the gradual acquisition of skills. Our responsibility is huge. I'm going to give you a quick overview of the numbers and the heft of our challenge. Nowadays, we have almost 3,709,000 workers. We have challenges in terms of education, literacy, and the investment we need to make in all professionals. This is the distribution in Brazilian territory. In public service nowadays, we have almost 1,790,000 workers who are included in all of these policies that are currently being designed in terms of capacity building, since we believe that our role is working with vocational education offers, universities, and exert an influence in the practices and contents of the higher education courses that are available for health and all other courses, and in the permanent policies for education in health, which includes the workers that are in the market today. So bringing in digital technologies also depends on strengthening management of health. It depends on adequate training and also on identifying regional asymmetries and regional needs, which is the mapping we mentioned with planning for all of the Brazilian territories. We do that to strengthen information dissemination, storage, and data exchange activities, and promoting interprofessional communication. We will use ICT as a strategy to overcome social, economic, and geographic access barriers that are standing today in Brazil. So training processes for digital transformations are currently in course. We have invested in virtual environments for learning. So we have a very strong partnership with PayHo. These are some of the courses we have. UnaSUS, which is the Open SUS University. We have the Mais Médicos programs, which focuses on capacity building for healthcare workers online. We have AvaSUS. We have in 2023, we have done capacity building for local health agents, which is based on practical work, and of course, educational itineraries for the Mais Médicos program, in which we established a baseline to understand their background and therefore identify any possible gaps for every region in our country to invest specifically where it is needed. So we have large numbers. Our distance education in terms of numbers is quite high. We have an overall number of over 3,200,000 certifications that have been issued. We have currently trained over 196,000 ACS and ACE, over 13,700 doctors trainings, 8,600 doctors enrolled in the Mais Médicos program, and invested in specialization and improvement for residential preceptors, and information and connectivity technologies. I just wanted to show you our most recent app that was launched through Conecte SUS. It's called Equidade SUS, Equity SUS, released on October 10th. It's a way of reaching information and also to create knowledge working jointly. So it is our gender, race, ethnicity, SUS workers program. It is available to all of us who work at SUS, and we hope therefore to work with this tool and build a very important data set for us. It is accessible throughout Brazil. That's wanted to show you in the 10 minutes I had. Thank you very much for your attention, and should you have any questions, I'm at your disposal.
Por su presentación sobre
Thank you to Dr. Cardoso about the topics relating transformation of education and experiences in Brazil. We're going to continue with Dr. Leslie Ramsamy, Counselor of the Ministry of Health in Guyana. So please go ahead, Dr. Ramsamy.
Thank you very much, and colleagues all. It's a pleasure to be here. Let me start by apologizing for our minister. Today is cabinet and he cannot be here. Health human resource remains a major challenge for Guyana. Presently, the ministries of health, education, labor, local government, and the Ministry of Finance are engaged in ensuring that we have a health for human resource program to address this issue. Guyana is cognizant of the emergence of innovations and technology today in the training of health professionals. Innovations and technology that have had a transformative impact. Much of the reforms in health professional training in Guyana fall under the umbrella of instructional innovations, mainly technology-facilitated education. One transformative change in health professional training is the explosion of online resources and technology to support training of healthcare professionals. Brazil made a huge reference to this. Guyana is using virtual training through Coursera and other open sources. In Guyana presently, for example, more than 1,200 young people are enrolled in nursing assistant and registered nursing courses. Another 2,000 students will be enrolled in nursing education in 2024, obviously addressing the nurse shortages in our country. Training for nurses is not the only beneficiary of virtual training. In December 2023, a few weeks from now, 32 students will graduate with City and Guild certification. This is a UK-based certification body as biomedical technicians and will be hired to provide much needed support for maintenance and repairs of medical equipment in laboratories, in ICUs, in operating rooms, and in clinical wards. In 2024, another 40 students will embark on similar studies, and a new online course for advanced training in biomedical technology will be introduced. This training is facilitated by a UK NGO, Medical Aid International. Virtual training is also being used for training of various specialist trainers, such as including allied health professionals, public health professionals, and for continuing education. Clearly, there must be curriculum changes. Curriculum changes have been made to facilitate virtual learning. Working with the World Bank, with the Pan American Health Organization, the University of Sao Paulo in Brazil, Mount Sinai, the Canadian Association of Nursing Schools, the University of the West Indies, Guyana has reformed nursing curricula and curricula for other professionals. While some public health programs are being conducted with 100% online coursework, most of the programs, including the specialist training, nursing, and allied health programs, are being conducted through hybrid curricula with a component of face-to-face in-person training. Relevant to curriculum changes, more focus is being paid to competency-based education. Our new curricular transition away from discipline and knowledge-based curriculum to include vertical and horizontal curriculum integration, student-centered approach, emphasis on primary care, professionalism and interprofessional education, more practice versus theory-based training, expansion from hospital-based to hospital and community-based practice, self-directed learning process, reducing curriculum overload, and increasing time for self-directed learning. New allied health professional training programs are being introduced with hybrid training. For example, respiratory therapy and respiratory technician training are being introduced presently. Curricular development has been pursued in partnership with several institutions in Texas and other United States universities. At the same time, Guyana has signed a cooperation agreement with Mohawk College in Canada for allied health professional training that will be delivered through hybrid virtual and in-person program. By the end of Q1 in 2024, Guyana will establish both advanced and traditional simulation training for student nurses and dental students. These simulation labs will be used also for continuing education and in our specialist training program. Artificial intelligence has become a new tool being utilized in Guyana for training of professionals. Presently, artificial intelligence is being used in both training and diagnostics in imaging medicine, while episodic AI-powered virtual training has been used in Guyana since 2008. AI-powered virtual training is now being informally integrated into the training of health professionals. Already, AI is being used in both diagnostics and training in radiology. Guyana's simulation and AI training labs seek to utilize virtual patients and mannequins, but increasingly incorporating gamification of major educational concepts and augmented reality. Medical, dental, and nursing schools seek to build simulation and artificial intelligence for clinical skills training. Since 2006, Guyana has introduced specialist training. Presently, Guyana has training programs in 18 postgraduate areas for both physicians and nurses. Specialist DM postgraduate training for doctors are providing Guyana with certified specialists in trauma and emergency medicine, internal medicine, infectious disease, obstetrics and gynae, psychiatry, general surgery, orthopedics, neurosurgery, anesthesiology, etc. Bachelor's and master's level specialist nurses are being trained in anesthesia, emergency medicine, critical care nurses for general ICU, cardiac intensive care, neonatal intensive care. All training in Guyana are accredited either through local accreditation mechanisms or via international accreditation. The School of Medicine at the University of Guyana is accredited by CAMC, a CARICOM, Regional Regulatory Authority for Medical Education. All postgraduate programs are sanctioned by the University of Guyana. All training programs have international collaborators, such as McMaster, Sao Paulo, Dalhousie University, Vanderbilt, Northwell, and Mount Sinai Health Corporations. It should be noted that most of the specialist doctors stay in Guyana with greater than 95% retention rate. Institutional reforms for training of health professionals include expansion of players. For example, whereas health professional training has been largely the responsibility of government or government-supported institutions, the private sector has become an important player in medical education. Among institutional reforms is further reforms in task shifting. Guyana is not new to task shifting. In fact, Guyana is one of the pioneers of task shifting. Task shifting has always been used as a tool to address shortage of staff. Presently, almost 500 patient care assistants are being trained. These PCAs are being utilized in clinical wards for non-nursing duties, such as assisting patients to get up, go to the bathrooms, etc. Training programs, particularly training for nursing and other allied health, are being aggressively decentralized. I want to end on this note. Eligibility for entry into the health sector human resource cadre has been severely restricted in the past. The curricular reviews I have referred to before is seeking to empower more people to gain entry into training programs. The almost elitist eligibility criteria are being adjusted not to lower quality, but to empower more citizens to gain access to competency-based education in the health sector. Colleagues, the challenge is real, but Guyana is being proactive in addressing the issues. Thank you all very much.
Thank you very much, Dr. Ramtami, with experiences of Guyana in the transformation of education of health professional careers. We'll continue with our last presenter, la doctora Gloriana Mora, jefe de la Unidad de Recursos Humanos.
Dr. Gloriana Mora, Chief of the Ministry of Health in Costa Rica, who will speak this Central American experience in educational transformation from the sanitary. Go ahead, Dr. Mora. Thank you, Dr. Portas. Initially, I want to thank you for the opportunity to be here presenting you the experience regarding transformation of education towards 2030. I want to apologize our Ministry of Health because due to many issues, she can't be here today with us. But today, I'll be here presenting what will be the experience in Costa Rica in this matter. I'm going to then share my screen.
Configuración de visualización.
Exacto. Es que no lo podía ver. Listo. Ahora sí. Muchas gracias.
Thank you.
Que no lo puedo desaparecer. Qué pena. Bueno, creo que inicialmente voy a hacer
I believe that initially I'll make reference to the objectives of sustainable development. The objective 4.3 speaks about quality education, and it's real clear in telling us that from here to 2030, we need to make sure access to all people for the technical, professional, and quality. This includes university studies. Additionally, the goal 4.c tells us that from here to 2030, we need to increase the offer of qualified teachers. And about those two goals to 2030, from the Ministry of Health, we're planning and designing actions that will allow us to assure that we're going to have this quality training facing the transformations that we're addressing nowadays. One training that has to be aligned with the epidemic and demographics profile of our Costa Rican population that can be adjusted to illnesses that affect the most people here in this country, and also that we can tackle the challenges that we have regarding digital health, interprofessional education that still in the Central American countries, we still have difficulties and limitations to implement this. To go in full with the challenges we have as a country from the Ministry of Health and jointly with the other bodies, we have to say that education in Costa Rica belongs to the Ministry of Public Education as the leading body, and the universities, public universities, specifically the University of Costa Rica, that trains personnel in health is autonomous. So we need to work in coordination for the development of activities and public policies that will allow us to focus in improving quality in training in universities and to graduate and postgraduate, and for technicians as well. And likewise, we can invest efforts in improving quality and the teachers' qualifications. This is a challenge that we have. Initially, digital health, I believe all our countries in the region and in the world, we really faced the changes during the evolution of technologies, globalization, inclusion of specific technologies, digital experiences, and on, which merit that our education can focus on providing the competencies, skills required for people, for persons, the future professionals in health, so that they can use these technologies and get support in them. Like they said at the beginning, many of our colleagues, I believe the digital training and inclusion of in the curriculum are fundamental. And this, I'm going to make a reference when we speak about the institutions that provide services, but it really puts us facing the challenge, which is adjusting our curricula with the requirements that our health services providers and sanitary technology requires. This is evolving really fast, but maybe our curricula in this country don't evolve at the same pace. Interprofessional education, here in Costa Rica, we have the basic devices in communities. But if it's true, those basic devices have an approach in the primary health strategy, it's fundamental that we start working in inclusion, in including topics as interprofessional education so that those working teams can develop better their labor. In this country, we've been speaking about interprofessional education and how we can incorporate it from the different curricula so that during when the people get to their working units, they can develop their functions better. They can have a team that really works as such to provide this service to a local level. Qualified teachers, I believe that from the beginning, I really emphasized on this element here in Costa Rica, and it may be the case, as we were saying, with in some countries in the region, in Central America. Many of the teachers, of the professors, even to a technician level, they are not qualified to be teachers, which sometimes we do, is that despite we have a basic payroll of teachers to be approved to teach certain curricula in universities, we have some changes because teachers leave, others come, and due to this need to get a substitute, we can sometimes hire people, professionals in health sciences, but that they don't have the competencies, pedagogical competencies to be teachers. And we realize that this is something fundamental to work on the quality in training. And this is one of the challenges that we have to transform this education. If we want quality education, we need to assure to have qualified teachers that can guarantee this quality education. Also, some of the challenges that we as a country have, and that, like I said, speaking with colleagues from the rest of Central America, we identified there's an offer of training programs. Here in Costa Rica, we have a public university, the University of Costa Rica, which is the one that provides all the programs in the public sector for undergraduate and graduate and even technical levels. Nevertheless, for careers as medicine and nursing, we have 8 private universities, and about, if we're speaking about psychology, it's 30 schools that provide the services, which make us now to have an oversupply of programs and professionals. And our greatest challenge is to regulate the oversupply and that we can plan professional training according to the needs of the country and facing the challenges that we spoke about, interprofessional education, health. And the adjusted curricula. We've done a diagnosis because we're in the process of the National Plan of Human Resources in Health. And based on this diagnosis, we realized, speaking with different social actors, that the curricula for training of our professionals and technicians isn't adjusted to the quality of the service. What I said before, the digital transformation, the need for these devices, professional teams to a local level, developing interprofessional teams for immediate response is not adjusted to what we have during training. And we need to get to a strategic point in which our curriculum can be adjusted to the needs that we have, not only as population, but also the providers that are working with new technologies, that are looking on ways to improve access to health services in a quick way, in a remote way. And we need to adjust that curriculum facing the situations that are coming. As opportunities that we have in our country, like I said, the National Plan of Human Resources in Health 2023-2033. Excuse my mistake. This elaboration of this plan we wanted is to harmonize and coordinate the national system of health with all its institutions with the national education system in a way that we can generate public policy focused on training and specifically regarding health interprofessional teams, primary healthcare. Our idea is to start training professionals that the country needs with the competencies to develop their work, but also in this planification, which can allow us to have and also to regulate this over offer, that we can have other problems and also unemployment, because professionals in health science, they have really precarious conditions in some cases, and otherwise they are unemployed working in other sectors that don't have to do with health. And we really want to recover the workforce to have them working in national health system, because this is what we need to take forward providing services, the wait lists, and all the emerging issues that are given, like the pandemic, for example. Another opportunity that I believe that the country has that focuses us on this training is accreditation. By national law, we have the National System of Accreditation of Higher Education, which is called SINAES. It's not mandatory, it's voluntary, but it's a quality signature that as a country we have. And what we are promoting between university training initially, because they can have from technicians up to postgraduates and doctorates. The idea is that to start with the postgraduate courses in health sciences to advance towards this accreditation from SINAES. We're also call them for external accreditation with university bodies from abroad. But for now, as part of the plan, we want most of our programs to be accredited by SINAES, which is going to help us the homologation process of our professionals within and out of our borders. I'm going to finish with this. The last point that we've divided into, but that early can work in just one, it's the implementation of the virtual campus for our universities and schools. Even some, they have the virtual campus, which is a fundamental tool for this continuous education and permanent education that we need to promote within our professionals to improve the competences, to acquire new competences of those people that have to face the challenges that we spoke about. The virtual campus in association of professionals. There are opportunities that we as a country have to transform our training programs in education to our professionals to 2030 and also to answer the objectives. Thank you so much. Thank you, Dr. Gloriana Mora, Director of Human Resources of Ministry of Health of Costa Rica. Having said this, we've finished this presentations stage from the experiences in the three countries that represent the continent, because we have from South America, Central America, and the Caribbean. I'd like, we're consolidating some of the questions, which are a lot in the Q&A space. Maybe I want to give a summary, because really the richness of what it's been said, it's a lot. But I believe there are elements that have to do with concrete areas, the importance of governance of human resources in transformation of education. We're speaking about accreditation. The three panelists spoke about it. Also developing public policies that can strengthen permanent education, like in the case of Brazil. Also Guyana and Costa Rica mentioned this. So governance from the education perspective is key. They've also seen, and the three presentations have taken us to, and the common experiences regarding digital transformation, and we see that we have a strong trend regarding that. This transformation really can have to do with education transformation. This is some of the other elements that are being consolidated from the presentations. Also the curricula. This has been a very common topic in all presentations, and the relevance and need of this adjustment, as Costa Rica mentions, or update in such a way that it can take key characteristics as the needs of the population, and also that it has to have a relation with new technological areas, including digital health. Something that also repeated is the interprofessional teams. I believe that interprofessional education has been mentioned by all the panelists as a fundamental issue, which will have a different vision of health careers. We're going to go to the Q&A session. I'll make a brief summary of the questions. I'm going to repeat. We cannot cover them all because there are a lot. They're all relevant. But I want to read the questions and then give space to each of the panelists to have an answer, maybe general, because it's many questions. As some of the colleagues and participants mentioned, the educational methodologies. Which are those methodologies that would allow the strengthening of health teams? Then regarding the changes in engineering, they have to be devoted to the teacher as a trainer, or to the professionals as health providers, or to both? Also, another question that maybe later we can see regarding the way of public training, and Dr. Magaña, that's here with us, she can answer that later. The role of the professional associations in health in continuous training for human resources. Also for Guyana, a specific question regarding methodology used for the design, which quality indicators we can use in that proposal. In general, there's many comments regarding curricular transformation. One of those comments I speak about, if transformation has had any impact in the transformation of the health systems and also training in primary health. This participant speaks about the competences, the minimum competences in primary health are really a debt in training of our human resources. This is just in general terms. I repeat, we couldn't read them all, but based on these comments, I'd like to have this Q&A round.
Empezar con la doctora Isabela
So I'll start with Dr. Isabela Cardoso. And let's have just quick answers, 2-3 minutes in general to have space to continue.
I think the questions are very relevant. The first, in terms of methodology for education, all of us who spoke today spoke about the importance of transactional methodologies, because we understand that capacity building does not merely restricted to bringing people together, but rather to bring them into collaborative teams. During the pandemics, we had a few examples of how important, in terms of a medical emergency, to come together and produce answers. We're here building indicators, both in the perspective of education, to make sure that this interprofessional education does happen as it should, and WordPresses, and therefore we need to interfere in the design and execution of these methodologies with touch upon these interprofessional practices. I think it's very important to think about bodies of practices, what facilitates that, how one professional can collaborate in each team, how each professional can collaborate in each team according to their own competencies. We have had several discussions in terms of practical methodologies for nursing. All of these discussions are very important. Also, dialogue with professional associations, establishing a dialogue with all of the institutions that operate and especially oversee and guarantee quality for work practices. I think these associations are very important for this debate. So we're working with them, institutions, working as a group. We're discussing the educational process in Brazil. Okay, I think I'm out of time, right?
Muchísimas gracias, doctora Cardoso. Damos la palabra al doctor Leslie.
Thank you, Dr. Cardoso. Now it's Leslie Ransome. If you could answer the questions.
Thank you. Let me just do this quickly. In terms of training, greater than 95% of the training in Guyana are led by the public sector. The private sector training is an emerging area for Guyana, but still a small number, mainly for medicine, for doctors. Allied health, nursing are exclusively led by the government. In terms of the trainers, as we reform the curricula and as we add new technology, we have to be careful that it's not only the student that we have to focus on, but the trainers, because many of the lecturers, the trainers have come from an era where technology, competency-based training, and so were not the main training focus. And so we have to also have programs at the same time to build capacity for the trainers. The professional bodies to regulate have to be kept updated and also have to benefit from the training, because one can't implement regulatory things without being themselves having capacity building exercise done. In terms of quality and how the design of the curricula are conducted, we have benefited from extensive research done in institutions around the world, at Harvard, in Canada, at Calgary and McMaster, Dalhousie, Vanderbilt, and Sao Paulo, etc. And so we have had an extensive, rich collaborative arrangement as we reform and add innovations and technology to our training program. Thank you.
Thank you very much, Dr. Ramzami. Vamos con los comentarios a las preguntas de la doctora Mora. Adelante, por favor.
Now we go with the comments of Dr. Mora. Thank you, Doctor. Well, I believe that I coincide with my colleagues when we're speaking about educational methodologies that have to be dynamic to transform. We initially think about including the interprofessional teams. We need to work from training. In this education that will allow us to have teams, multidisciplinary teams, to answer the needs of the population. And I believe that this is where we, as a country, we're heading there. Specifically, when we speak about training of those professionals that work in the basic teams, this leads me to the primary health issue that popped, which is a debt, of course. Yeah, I believe that from the academia, what we spoke about, and even with the professional schools, we need to start including or incorporating all topics in strategies, public issues that are main in our training, because it's true that our physicians, pharmaceuticals, chemists, they're good in the clinical side. We need to strengthen the knowledge that they have if we want that our education transformation to be aligned with the transformation in service providing in our models. About the programs for updates, I believe that they have to be targeted to both, to teachers and students. We're always speaking about the curricula and what the students need, but we need to have qualified teachers and well-trained so that they can teach the knowledge. Otherwise, the knowledge replication won't be in the best way or the most adequate way. Ideally, we need to have those curricula adjusted, facing what we are battling, like the teams, digital health, but also we need to have the same training for the teachers. In Costa Rica's case, the role of professional schools is fundamental because professional schools are in charge of auditing the profession exercise, so they help us a lot in continuous education and permanent education. We want to migrate those programs towards re-certification professional programs to we can foster quality in each of our professionals. I believe that this is all from my side. Thank you.
Las gracias a todos los panelistas del día de hoy, la doctora
I
Isabela
want to
Cardoso,
thank everyone today, Dr. Isabela Cardoso, Gloriana Mora, and Isabela Ramzami. And now we have our moderator. Thank you. Thank you, Dr. Puertas, and thank you to the panelists of this panel number one. Up next, I would like to give the words to Dr. Benjamin Puertas, Chief of the Human Resource for the Department of PMS OMS, which is going to present the document policies about Health Professional 2030, strengthening of human resources for health, so we can have resilient health systems, which tries to support countries to build an answer with the construction of policies that answer the needs to answer many of the questions that you have posed in the chat regarding the relationship between health and education, regarding the need to train professionals in health to answer the real needs of the population and the complexity in such a way that now Dr. Portas' turn. Go ahead, Dr. Portas. Thank you, Dr. Acuña. I'm going to start having a brief walk on the main challenges and the current crisis related to the labor force in health. I won't stay much on this, but it's important to see the gaps of health professionals that we have in our continent. You can see the line of 44.5, and in those countries that are above it, and those countries that haven't achieved this level, without considering that in even the countries that achieved and overpassed this 44.5%, not necessarily means that they don't have challenges around their labor workforce, because there can be some inequalities in internal distribution or even the number of professional categories that includes this indicator. Regarding the number of physicians graduated by 100,000, we have a broad scope of experience and statistics in the region countries, with countries that pass by far the average, that, for example, from the OECD, and others that are below it. Similarly, with the number of graduates in nursing, we have some countries which have very, very important numbers, but in other cases, we have countries that have serious gaps in the number of nurses graduated. In the Americas, we have 825 approximately schools of medicine registered. There's more than that, from which the greater number is in Brazil, in the USA, and Mexico. Among the top 3 countries that have more than 60% of medical schools in the Americas. Regarding nursing, we have approximately 1,600 nursing schools in the region. 90% of them are in 2 countries, Brazil and the USA. But this doesn't mean that we don't have a serious problem, a serious challenge regarding the deficit in human resources. That according to an analysis done in 2019, we can reach the 2 million of human resources for health in the Americas distributed, as you can see in the chart, with more than 230 doctors, more than 1.5 million of nurses, etc. In general, the big challenges that we have around strengthening human resources in health in the region that have to do with governance and leadership, with education and training, access to quality, and also the information systems. Here we've seen that there are challenges regarding regulation and quality, the capacity to plan and to foresee the human resources in the countries, the low investment regarding recruiting and keeping that personnel, and also the need of a framework that can allow us to go forward. Regarding education, we've seen in the questions there were many related to this lack of aligning between the needs of the population and human resources. We also have limitations regarding interprofessional information based on competence, accreditation, and we know the lack of investigation that we have in our region regarding access and quality. Migration of human resources have certain areas in our continents is very labor conditions, mental health, protection and well-being of workers, and information systems. All this taken for the organization of the member states identified a series of strategies, action plans, and policies that want to strengthen human resources in health. I'm going to refer to one recent that's really the horizon that we have, and it's the Personal Policy 2030, strengthening human resources to achieve resilient health systems. This resolution was approved by the board from OPS in September 2023 with the ministers of health and delegations from all the Americas countries, and it was approved unanimously. All countries in their analysis they spoke about many of the things that we mentioned today. This policy has 5 strategic lines in general. The first has to do with strengthening governance and promoting national policies and plans for human resources. The other has to do with develop and consolidate regulatory mechanisms, strengthen the formation of interprofessional teams and their integration into integrated health services, enhancing workforce capacity building to address population health priorities and support public health emergency preparedness, and promote decent working conditions, protection of physical and mental health of health workers. In the first, we're speaking about developing public policies in human resources for health, which focuses on planning and forecasting human resources, developing these information systems, developing a curricula that promotes the impact of science, evidence, and innovation. Everything that has to do with roles, profiles, and competencies of health workers and improving working conditions, career paths, and staff distribution. The second strategic line has to do with consolidating regulatory mechanisms. Here we have lots of work to do regarding updating the legal framework that has news related to recruiting, compensations, working conditions of the health worker, and adjusting this regulation in the professional practice, regulating the quality for health professionals, motivating and promoting cooperation between countries, especially in issues that have to do with an international vision as the migration of health workers, developing regulatory frameworks that can promote the delegation of functions. And also, we spoke about the importance of that this training can be according to the national priorities. The third line, strategic line, has to do with strengthening training of interprofessional teams. This is what we discussed in the panel in a great number of occasions. And the importance of having interprofessional teams, especially in the first level of service and within the service, with a adequate answer, the right competences, and with an intercultural approach sensitive to equal gender. Also adopting and systematizing innovations, technological innovations, which was spoken about in the previous panel. This goes in hand with the digital transformation, as the other panelists comment, and the innovation of health models that depend on the territorial context with interprofessional teams organized jointly with community and supported by digital health solutions. Regarding quality, here it's important collaboration between the educational and health sectors, and the policy has an emphasis on this training, virtual training, with simulation. We've heard about the digital intelligence as part of this digital transformation in health focused on people. We also spoke about the itinerary for learning, by meaning a continuous education with strategies that go beyond, but within an itinerary of training. They're fundamental to improve the capacity to align with the needs, to have the competences based on evidence. And here I mentioned the virtual campus of PayHo as a convergent platform which allows this strengthening of virtual education. Here for you to see the campus that we currently have close to 3 million users and with more than 6 million people that enrolled in courses, being nurses and medical doctors, the ones that participate on the campus courses. And most of them come from hospitals and primary health services as a way to strengthen this virtual education process. And the last of the strategic lines that have to do with the decent working conditions, protection of the physical and mental health of health workers. It has to do with the adequate conditions of work.
Factores que inciden en la migración de
trabajadores. One of the factors that have to do with the migration of workers in the Caribbean, for example, is the working conditions that were even more important than the salary that they could get. What strategies to keep this personnel and technical cooperation with the beneficiary countries? I believe that we need to have an important positioning regarding countries that import physicians, nurses, dentists from other countries, and that they have to respect the international recruitment of health professionals, and also having bilateral agreements that can have a more equal situation to keep the gender perspective. And something that the pandemic taught us, the importance of health, mental health, and welfare of our personnel that has to be guaranteed. This is what I had about policy. I don't want to take more time, but I believe it's important that after listening to the previous panel, we could see the perspective of what the strategic lines of the policy propose. And OPS, of course, has all the strength to support countries in this challenge. Thank you. Thank you, Dr. Puertas. It's fundamental that countries can implement their own national policies about the baseline of this regional adopted by the member states, of course, with the support of our offices too. And now to finish this webinar, we'd like to let the panel number 2, in which the panelists will speak about which are the tendencies and opportunities in the transformation of education for health professionals in the global context or regional context. And now, in charge of this panel, we have Dr. Silvia Cassiani from PayHo, which will be the moderator for this dialogue space. It's a pleasure for us to be here in this panel, and we greet all the panelists. This panel has as an objective to discuss which are the tendencies and opportunities in the transformation of education for health professionals in the global context. For this, we have the presentation of Wendy Seeley, Dr. Marcus Nunez, and Dr. Laura Magay. To start, we're going to invite Dr. Wendy Seeley. She is a lecturer in lecture program coordinator. She has a Master of Science of the Faculty of Medical Sciences of the University of West Indies.
Member of several faculty, campus, and university committees. Dr. Seeley, please, the floor is yours. Thank you.
Thank you so very much, Dr. Cassiani, and thank you to PAHO. I express sincere thanks for having me on this session. Please permit me to share my screen. I will be presenting to you today about nursing education, lessons and innovations learned from the pandemic, certainly within the context of transforming health professionals' education by 2030. I will have a background. We will be looking at the innovations and lessons learned. So from the perspective of the background, there are two programs which were delivered here, are still being delivered here at the University of the West Indies Cave Hill campus. The first program was planned and implemented during the COVID-19 pandemic. And this was a program which is part of a wider project which was undertaken by the government of Barbados to support the excellence and development of pediatric care in Barbados and certainly the Caribbean region. We commenced this project, it was launched back in February of 2020, but as you would imagine, the pandemic struck in March of 2020, and therefore a lot of the time was spent planning during the pandemic. We were fortunate to be able to have, we had a number of challenges, but we're fortunate to have a robust team who were able to make sure that we were able to implement this program. To date, we've graduated 2 cohorts, one cohort in October of 2022 and the second cohort in October of 2023. The second program required a transitioning of a master's program from a face-to-face program to a blended program. And this program was started in September of 2018 with the idea that the first cohort of students would graduate in May of 2020 with the understanding that we would have been delivering this program face-to-face. However, we were required to move very quickly to place the remainder of the program online, and it required a lot of innovation, but we also had some challenges. So how did we do this? There were a number of innovations, and these had robust collaborative arrangements where there were clear terms of reference for planning and curriculum development and very targeted guidelines. We had multifaceted stakeholder engagement from clinical practice, the regulatory body for nursing, academia, content expertise, and certainly the governance within all the entities who were involved in the engagement of making sure that these programs were delivered to the optimum level. There were also creative teaching and learning methodologies used on the various learning platforms for both classroom and clinical teaching. One of the things that we could boast of is that we had benchmarked quality assurance standards across our jurisdictions, recognizing that there were similar programs being offered at Mona and St. Augustine, and we collaborated with each other to make sure that these standards were maintained while still meeting the demands of the challenges that we faced. Customizing of the curriculum processes were elements that were key. And while we recognize these as innovations, they may appear that these are activities that are regular, but because of the flexibility and the creativity that was required in order to be able to execute, we certainly were very innovative and continue to be. There were critical stakeholders who were involved at the national and regional levels of the pandemic, but we learned a lot of lessons. They meant a lot of flexibility, timing, availability, and accessibility, and communication was key. Core group members kept minutes and developments of action items and deadlines, and it brought us to a point where we were able to deliver and continue to implement these programs at a very, very high level. So what were the lessons learned? There were a number of lessons learned, and we recognized it was important, and we still continue to do continuous faculty preparation and update on subject matter content, and pedagogical strategies for delivery of the curriculum. Support the faculty engagement with technology in the delivery of course content and assessments. A lot was said about hybrid programs and blended programs, and I can attest to this. Preparation of our faculty, well, we want to prepare our students. Capacity building of our faculty is key. Preparation of our faculty here at UWI was key in making sure that we were able to continue to deliver our programs, whether in the face-to-face format or online, and certainly preparing us for these particular methodologies. Facilitating flexible delivery methods as hybrid and blended teaching learning processes and delivery times. Strengthening collaboration with colleagues across campuses for standardization of delivery methods, assignments, assessments, and activities for specific courses was key. Continuous communication with faculty using various modes to clarify and update, keeping the messaging simple. And noting the identified difference between remote emergency teaching and online learning, which we know there are two different modalities. What were the lessons learned with respect to the students? All of our students were still working on the front line. And it is important to recognize that while we will want students to be supported in their education and to be fully engaged, we recognize that there's a shortage of staff in the clinical setting. And for most of our students, they have to continue working while still pursuing their education. It was critical for us to recognize and continue to recognize the contribution of these nurses on the front line while still pursuing their education. We would have lost some of our nurses, even some of our graduates, but we also recognize that it was emotionally supportive to have their families involved. And this we did as we recognized them for their efforts on the front line, but also in the academic area. Standardizing communication channels for students at all levels, online, during formal and informal sessions, and continue to create the opportunity to provide mental health support as needed. Creating flexible office and supervision hours, even on weekends and late nights, are some things that we still continue to do to support our students going forward. Recognizing the importance too of supporting and engaging interaction in class sessions required planning and creativity. Graduate students also used the opportunity to research the implications of the pandemic for student success in the following areas. And two of these are highlighted here. One student, Ms. Jordan, looked at transitioning from face-to-face learning to emergency remote teaching. And the other student looked at the role of technology in clinical nursing education. These research studies reveal some very key factors. The fact that educational impact requires engagement with course material and changes in course structure. The physical and mental impact of transitioning from one modality to another requires coping strategies and may create stressors. Technological challenges create the opportunity for networking, and computer literacy was key. The second study, which looked at the role of technology in clinical nursing education, highlighted student-related factors such as personal and positive attitudes, as well as negative attitudes to technology, and what are students' knowledge with engaging with the technology, finding that the older students have a fear of the technology, while the younger students tend to have a savvy for the technology. So we have to recognize the different learning styles and the abilities of our students. Institutional factors were revealed as key in supporting students' learning, clinical learning using the technology. What are the technological tools and the institutional factors to support this? Is there enough equipment? What is the status of the equipment? What are the resources? And what are the opportunities for us across the region? Because sometimes it is not a level playing field. We are operating at different levels of access to resources and equipment to be able to support simulation and such. And certainly, what are our situational factors? No access to clinical sites at the time. So what are some of the strategies for creating curriculum transformation in nursing education? Strengthening our clinical teaching and learning processes, not only for the students, but certainly the faculty. Interprofessional learning, and we've seen the evidence where interprofessional learning at the pre-service and in service level has strengthened the patient outcomes in the practice setting. Competency-based curriculum and strengthening these curricula to ensure that our students are meeting the needs of our countries and certainly our region. We cannot underscore the importance of information technology and e-learning and making sure that our faculty and our students and even our practitioners are well prepared for the technology. Collaboration and partnerships are very key. We can't work in silos. We need to work together in order to ensure that we meet the needs of our country. And certainly case-based learning within the context of competency-based learning is key for making sure that our students are exposed to real scenarios. Thank you so very much for listening to me, and I look forward to hearing from you.
Thank you, Dr. Wendy Seely. Excellent presentation. And vamos pasar al español. Y nos gustaría en ese momento invitar al Dr.
Now, we'd love to invite Dr. Marcos Núñez, President of the Pan American Faculty, so that he can present his. Please, Dr. Marcos Núñez, it's a pleasure for us to have you here with us. Please go ahead. Thank you, Dr. Cassiani. Doctor, you are in mute. Thank you. We want to thank Dr. Cassiani and the Pan American Organization, Dr. Benjamin Portas, and the organizing team for the invitation to the Pan American Organization and Association of the School of Medicines. The Federation represent the medical studies in the American continent. We represent the federal. We include associations of countries with medicine schools from Canada up to Chile and Argentina. We all live the impact of COVID-19, and I want to reflect on this slide. Really help us to amplify significantly the gaps and inequalities within this COVID impact, and especially in our doctors. We have a great number of information to a point that it took us to an infodemic and an infoxication. The other thing is that the pandemic became in a syndemic, with no doubt the great impact in the sick people, the people had to suffer in loneliness, and especially those seniors, an impact that some called psychiatry of loneliness, with no doubt one significant repercussion in human relationships, even for pediatricians, for teens, adults, and seniors, with no doubt a significant increase in the digital gap between different countries. And COVID-19 makes us see how overloaded we are in our studies. Within the lessons learned, with no doubt, we had to leverage on the established platforms and the human resources that were trained on virtuality. We noticed the impact of social media and communication means, and the need to adequate our study plans. Also, the need to foster the interprofessional education, which, as we mentioned in today's forum, to identify the best observation practices and a big opportunity to do synergies and coalitions at all levels. I have to go from reaction to action, and this forced us to develop strategies as urgent training in virtual education, using especially to that staff who's younger involved in virtual sessions. Within the FEFAPEM, we identified through webinars the best practices in the continent, and this allowed us to replicate in some of our countries those strategies. With no doubt, the application of telehealth for handling and following those patients with chronic illnesses. We established support services, having the psychology, schools, and establishing hotlines 1-800, especially for frontline physicians and health professionals to develop protocols to progressive return within as safe as possible. Voluntary at the beginning to return to the hospitals. From the challenges, no doubt, migration, global warming, and the challenge that we'll have to unify health, one health, having the same scenario, the animal health, human health, and the environment. Challenges, we need study plans based on APS to identify the competences of the physician of Century 2021, to have this interprofessional training and self-care and intercare, to try to develop towns through the happiness index, to learn from those threats, to make them into opportunities, and demand the inclusion of academia in planification and implementation of public policies along with the state and the society. And I want to finish asking these three questions. Are we better human beings to be witnesses of this pandemic? Have we leveraged the experiences to be better citizens of the world? Are we prepared to tackle a next event like this nature? Thank you. Thank you, Dr. Marcos Nunez, and thank you for being on time. Very interesting what you posed with your last three questions. Even it really caught my attention what you said about identifying best practices to replicate them. This is exactly the objective of this webinar when we call experts to share with us and with all the 664 participants which are here in this webinar to listen to your experience and to reflect as you propose. Now it's a pleasure to me to invite Dr. Laura Magaña. She is the president of the ASPPH Association. Dr. Laura, please go ahead with your presentation. Thank you, Dr. Cassiani. Thank you to the Pan American Organization of Health. It's a privilege to be in this seminar with big colleagues that I've learned a lot, and hopefully we'll have enough time because questions in the chat are really good to have a talk. On top of representing the ASPPH in Washington, D.C., I want to tell you that I'm the president of the Global Alliance of Public Health Associations, which is an alliance that has all the programs around the world, 7. So my presentation has this touch, global touch. I'm really happy that many people that presented during the morning, they confirmed things that like we're doing from the public health that we see as a global policy tendency. So we're coinciding many of the things, and this is really a good coincidence. I'm going to start with something that we all know. Humanity is challenges of such a great magnitude with no precedent. We highlight climate change, the gap in inequality, the social instability and political instability, economical longevity, and artificial intelligence, just to mention some of the challenges. So it is the time for higher education in general and the programs of health professionals in particular. We need to reimagine in a systematic way the function that we have in society in our fundamental mission. It's crucial that we reflect on how we can have a catalyzing role in a quick transition towards equity in health, sustainability of the planet, and the construction of a sane and prosperous future. On top of those global challenges, our region in the Americas has really challenges like the previous panelists mentioned before. But to have it's a result of the systemic problems in the region, which is chronic illness, infections, aging, public emergencies, the scarcity of health professionals in the region as in the world. The 2019 pandemic revealed some lacks, the lack of personnel, preparation of the personnel, the speed of the attention, the lack of attention were some elements that were evidenced. Despite representing only 13% of the world population, the region sadly had 28% of global COVID cases and 42.3% of deaths by COVID 2019. So it's crucial to strengthen the response and recuperation of health systems in all countries in the region. And the health personnel is the pillar of this health system. So advancing and transformation of our preparation courses, it's important. In this crucial moment, we have the big opportunity, as in any crisis, to reimagine higher education in general and health education in particular. And for this, I want to address 8 specific areas that we need to consider in our transformation. Some of them, as like I said, were referred before. The first one that I want to comment is the need of a new social contract between the educational system and our students, which means learning throughout your life. Students and professionals immersed in digital economy, they don't foresee that their work trajectories are a linear progression in a university, 4 or 8-year university, according to the case, towards one single career. But they're aware that their current employments or careers eventually will be transformed or even will disappear, which will foster them to prepare for new work opportunities in different fields in unpredictable moments throughout our whole life. This happens in a moment influenced by globalization, environmental crisis, the change in demographics, longevity, and artificial intelligence. Learning and work are united that will go with us throughout our lives. So work transitions became part of life. Workers experience at least 12 work changes by the time they're retired, and they keep in the workforce until their late 60s or 70s, which are historically high rates. Throughout the prism of human longevity, the work is linked to education. It's projected that the life expectancy of children born in 2020 will be to 90 or 100 years old. Many of them will have to be working until the 70s to have enough savings to retire. The curricula of 60 years, coined by Gabby Matin, refers to a new perspective focused on continuous education and focused on 6 decades of work, which requires a permanent learning in the context of change and occupational transitions. The social contract between higher education and students will be extended for the rest of their lives. So imagine for a moment the structural changes that we need to do in all our education programs for this to really work. Now, with this new approach to have an emphasis on having a balanced life, healthy life, gratifying life. It's fundamental to prevent mental health issues and preserve a sense of purpose, belonging, and well-being. This implies learning in between work and life, and also facing stress and adversity throughout our lives. The periodical return to learning is the new normal. It will be necessary to have more in and out of the educational system for learning throughout life. Imagine a distributor. We need to leverage on education as if we were taking this transit distributor, acquiring what we need and going back to the labor high road. Learning and work is inseparable. This means to have an economy of knowledge or a learning society. As a consequence, if the work is becoming learning, then learning has to become work. And universities and programs have to convert into live systems to open, foster, and promoting flexible possibilities. A learning registry by life, well implemented, will help the workforce to show permanently their learning trajectory throughout their lives. Number two, we need to go from a telescopic vision to a kaleidoscope vision. The education is our strongest suit to give shape to the future, but to a whole level, the courses are designed with a unique approach for everyone. Universities have to reimagine the educational experience to foster one significant experience, but individually for each student. In a system dominated by a single approach for everyone, they cannot acquire the skills and vital dispositions to overcome the disruptions that we'll have. So how can educational supports help students to transfer knowledge from one position to the other? Only if we're based on our study plans on transferred competencies. We need to get rid of identities that are profoundly for a transformational change towards different educational programs, more effective, that will satisfy the needs of students and prepare them to prosper. To achieve this, students need unique experiences to adjust to their requirements, access to precise education and relevant education adapted to their needs, and the trajectory is adequate in the right moment. The learning experiences have to provide knowledge, skills, professional networks, and practices that will prepare students for the world. We need to go from content to competence, like we commented before. The standards of curriculum are full of information, easy to memorize and measure, but useless in a world in constant change, unpredictable, and guided by many of search engines. Strengths as resilience, perseverance, collaboration, conflict resolution, opportunity creation from uncertainty cannot be achieved in classrooms where compliance are the main behaviors demanded. Since the beginning of the century, we numbered the essential skills necessary for work: flexibility, creativity, initiative, innovation, and recently we highlighted even other professional skills. But it's difficult to mention the competences mentioned in the training programs. More than other professionals, health professionals have to be competent in at least cognitive and metacognitive, social and emotional, technical and specialized competences. Cognitive have to do with creativity, auto-regulation. Socials have to do with empathy, collaboration, resilience, respect, appreciation by diversity, and of course, the technical and professional competencies that we need to continue fostering, including the use of information, big data, all technology. The VIV in a recent publication, they mentioned that the essential competences in medical have to do with developing and strengthening health personnel. They mentioned the social competencies that are focused on the capacity of communicating, conflict solving, critical thinking, and technical competencies as the knowledge to scientific evidence and experience, and also digital competence are very important. Training has to be adapted to a broad vision of health, incorporating aspects not only from biomedical and clinical, but also, importantly, to include public health and the social determinants that impact in health and well-being. Some requirements will be populational health as the main axis of curricula to focus our health systems in prevention of illnesses and promoting health, and not just focus on providing services. The main service, the interprofessional education, as they comment, the respect to diversity, social responsibility, prioritizing training in disasters, including strategies to tackle climate change, obviously technological innovation and digital competences. It cannot be further due. From this, I want to specifically mention, even though my colleagues mentioned, the need to train our personnel in technology and digital competency. Artificial intelligence is here to stay. So we need to accept it and prepare our students, professors, and personnel to prosper in a digital and automatic world. As we all know, the present and the future of service and education, medical technologies, simulators, virtual reality, digital tools, they play a role, crucial role, approaching users through services as telemedicine, robotic surgery, and other technological innovations that will ease equal distribution and access and would allow to expand the coverage of health services. Telemedicine has accelerated the epidemic and will continue increasing, requiring strengthening by legislation and regulation. Daily interaction of the health personnel is inevitable with technology. Tasks will be shared between personnel and technology, highlighting the importance of the human skills. We aren't in a race against machines. If we compete against them, we lose. We are in a race along with the machines. And the future will be valid by how well we work with robots and technology. Tech will not replace us. With no doubt, will be replaced by other human beings that domain technology. A big part of our work wouldn't be possible without it. And the line between what we do and what machines do will be the medical area has more pressure in becoming digitalized. Technology allowed a better approach in interpersonal relationships. With no doubt, innovations in models will change radically. The medical education will demand the development of technological competences and digitalization as in any other area. I'll go quickly to number 4, which is really adopt hybrid models for education. It's fundamental to incorporate the hybrid models of learning. The virtual environments are very effective for training and complex, while the on-site face-to-face are ideal for social and emotional skills. In all cases, going beyond virtual or face-to-face models, the most important and the methodology of learning, as we mentioned, the advance in cognitive sciences and learning also. It tells that adults learn better when they're actively participating in their learning. You have to be active environments where students are involved in their own cognitive processes by solving problems, answer questions. The learning space have to replicate the labor work, or we work in teams to solve real challenges. So this education is essential in the case studies and rounds that were done in this profession. Next, we need to diversify the learning opportunities. It's our obligation. We need more organizations that connect education with the work needs and the new ways to alternate work and learning throughout your whole life. We need to value not only the academic levels, which generally take years and are less flexible, but also continuous education with flexible models as micro-credentials, certifications, practical trainings, internships, other ways of experiential practices. The future will have to do with diversity of models and educational schemes to support the future and human development. Also, like they mentioned, new roles for the academic personnel. The approach of the curriculum for 60-year curriculum requires educators and mentors of higher education throughout the whole life to support professional development of students. All those tendencies suggest the need to redefine, train, and support the staff and the educational leaders to execute the educational transformation that we need. We need the teachers to be competent to design learning scenarios, to evaluate competence, to interpret the panels, to give follow-up to the students throughout their whole life, to focus, guide, to be more mentors, and them being coaches. I'm going to finish with something that they mentioned before. It's really important. Health professionals are trained currently and historically in isolation, regrettably. But the work life is interconnected, so it's important to eliminate gaps and the silos and to go into education and the inter and transdisciplinary and preparing the students for the collaboration with other actors in society. Their active role in promoting change, transformation, and social impact is vital. In health services, interprofessional collaboration is increasing to address complex challenges through teams of different disciplines. This implies working alongside, understand different perspectives, and make decisions in a collaborative way. These teams are focused on addressing complex needs involving the whole team. Integration between health professionals and social service is essential to provide a complete service. We require a holistic approach that have to be fast to have interprofessional strategies that will later be intersector strategies if we really want to go forward in the well-being of our populations and the planet. As you notice, this is a historical moment and critical where we need transformation, radical transformation. So as you can see, we have lots to do to continue innovating and transforming education and health in our region and in our countries, and to assure a healthier, more equal, more safe and sustainable future for everyone in the planet. Thank you. Thank you, Dr. Laura Magaña. A big applause for the three of you that explored so well the issue of our webinar interest. There are many questions in the chat, but I'm going to summarize in one because we only have 5 minutes left. And I'm going to call the attention that one of the participants said how important education is in health sciences, working in strengthening the first level and strengthening the citizens, the epidemic vigilance, and the intersector work and interinstitutional work. I wanted to touch on this issue and ask you to briefly comment within the transformation and innovation of education, of the difficulties of resistance, and the resistance that we have here, the oversupply of training, and also the low investment that teachers that are invested in the staff, in training of teachers. I wanted you to comment in a general way how we can transform and innovate in a scenario that's it's being like this. We can start with Dr. Laura Magaña, which was the last one, and then Dr. Marcus, and later Dr. Wendy. Thank you, Dr. Cassiani. Important challenges we have going forward. We don't have easy solutions. We have a vision. It's most important to have the vision, go to the basics, and really start transforming. This is not about adding this competence, this model. We need to reinvent education to really be effective, and we can go forward. The only way is we're all together. The health system, education system have to be together on the table along with the community to see which are the essential competencies that we need. Let's remember that our curriculums, let me tell you in the chat, are over saturated. That's what we need to reevaluate. If all that's there has to be there in the first place, we need to go back to the basic competencies that everyone has to have, including not only the technical side, but an important part is social, the metacognitive, and also people will have a curriculum for life, will have opportunities for our life to be designing the competencies that we need at that moment. But the invitation is to redesign our educational system along with the community and the health system and all the stakeholders to really go forward. I also want to say about the teachers. It's important that teachers have a fundamental role, because if they aren't being transformed in this new educational model, then our curricula will be just on paper, but they're the important stakeholders in transformation. And leadership, as somebody else mentioned, of course, our educational leaders have to be in favor of this transformation. On top of what Dr. Magaña says, which I agree 100%, I also comment on what I said before. We're going to identify those best practices and we're going to apply it to our context. Because what could happen, what could be successful in one place, is not necessarily in our case. And also leverage on the link of collaboration with institutions like OPS or OMS to have a change together, because you have a prestige and you have a number of vinculations that will leverage the efforts that we could do. Thank you.
Dr. Wendy Seeley, would you like to go ahead?
Thank you. Could you please repeat the question in English? I missed it.
Okay.
Yes.
It's more related to the faculty and how to invest on them to increase the strengthening of the first level of care, the intersectorial and interinstitutional work, and how to transform and innovate with the support of the faculty, training of faculty.
Okay, thank you so very much for that question. I think it is a multi-pronged approach where we train our faculty to the level which they are able to deliver the competency-based curriculum and identifying faculty who are really interested. The other thing I think we also need to focus is on using our clinicians, the persons in clinical practice, to be able to train them up to support the students in the clinical setting from a collaborative perspective. The students need to have the support of the faculty from a theory perspective, but the clinicians are the ones who are on the front line, who are working with the clients and see the changes and can assist. So I think strengthening them with preceptorship programs and preceptorship training is a critical aspect that we can strengthen as well from the clinical side. And I also believe that our curriculum needs to be dynamic, and we need to be constantly preparing our faculty through continuing professional development opportunities, because the dynamic curriculum requires continuous development of our faculty as well. There are a lot more things I can share, but in the interest of time, I'll stop there.
Thank you. Thank you very much, Dr. Wendy Seeley. Gracias, Dr. Marcos, doutora Laura. Excelente. Y ahora
Excellent. And now we go back to our moderator, Dr. Cecilia Acuña. Obrigado. Thank you, Dr. Cassiani, and we thank the participants and the excellent presentations for both panels. With no doubt, there's many questions to answer. And this is a pathway that we're starting together. This is a pathway that doesn't finish here. We have so many challenges, as many of our panelists mentioned. And so to just have this dialogue open, we'd like to invite Dr. Benjamin Portas to give a final message to close our webinar and to reiterate the invitation for this to be the beginning of a pathway that will continue walking together in a way to incorporate the transformations which are so necessary in the new social, epidemic, and environmental scenario that we're living not only in our region, but in the country, in the world. Thank you, everyone. Go ahead, Dr. Portas. Thank you, Dr. Acuña. I believe that we've had a really interesting walk throughout transformation in education, and we covered a number of aspects that have to do with governance, to the education, the role of digital transformation, the competence and the curriculum based on competence. We analyzed also the participation of professional associations, private sector, of course, academic institutions as pillars of this, along with the health sector. There is articulation that Dr. Cardoso mentioned between the educational and health sectors. I believe that we take a lot of information, but also many questions, many challenges to address from the perspective of the Pan American organization, and specifically the Human Resources Unit, to be traveling through this webinar where we were able to dialogue, discuss about fundamental issues regarding this transformation. For us, it's again a challenge to accompany the countries in this tour that will be very important for this transformation. As Magaña mentioned, this is a total redesign of how we educate. And if we aren't willing to take the challenge, then we wouldn't really give an adequate answer to the needs of training of our personnel in health. The change has to be started now. And again, OMS is really willing for this support to countries in this tour that has to start now. I want to thank a lot again, all participations, questions. We are short on the number of comments and questions from our friends. And really, this fosters us for this discussion to continue, and it will continue. This is our commitment. Thank you. And now back to our moderator. Thank you, Dr. Portas. So just to finish, just one announcement. The presentations and the material of this webinar will be in the YouTube channel of the OPS for all of us that wish to have the reports. And we wanted to invite you to check again the presentations, to check the recording of this webinar, to continue speaking between you with us all together in this dialogue space to improve education of health professionals in such a way to tackle the new challenges so important for health in the world, in our region nowadays and for the future. Without further ado, want to close this webinar thanking you for your participation, especially our panelists, all the enthusiastic participants in the chat, and also the OPS, OMS team that worked together with the teams to continue in this round and to improve the health systems and to become more resilient. Thank you.
Doctora Acuña, quizás escuchamos a las últimas palabras de la doctora Rhonda Seeley que cierra el evento. Doctora, por favor, si usted está ahí para dar.
Dr. Rhonda Seeley, if you are there, can you give some final words? Thank you, Dr. Seeley. Well, as mentioned by Dr. Cecilia Acuña, we close this event. Thank you to all the people that participated. This recording will be in YouTube. And thank you once again. Big hug to everyone.